Managing Tracheostomy Emergencies for RNs and RCPs. In the U.S., over 100,000 tracheostomies are performed every year. 1% of trach patients will suffer a catastrophic complication. Half of all airway-related deaths in the ED and ICU are due to dislodgement or decannulation of the trach tube. In response to this, Dr. McGrath et al. In the UK devised an algorithm to help us deal with tracheostomy emergencies. Once a breathing problem has been identified and whether or not the patient can breathe, the next step is to assess the patency of the tracheostomy tube. It's important to note not to give a breath until patency has been determined. If this cannot be established, the trach is an obstruction and should be removed. The caregiver should immediately provide oral airway ventilation via a bag valve mask, while a second caregiver covers the stoma. If still unable to ventilate the patient, ventilation of the stoma with a neonatal CPR mask should be attempted. If all of these methods fail, the code team should attempt to intubate orally, and if that fails, they should attempt to intubate the stoma with a small cuffed endotracheal tube. This algorithm can be found on the back of the head of bed sign located in every trach patient's room. Now let's watch this algorithm being used in a real-life situation.
Hey, Mr. Jones, let's go ahead and roll towards me, okay? Bring your hand over this way and go ahead and roll. Mr. Jones? Mr. Jones? Hey, I need some help in here.
Hey, Molly, what's going on?
I just turned Mr. Jones. He's setting off the ventilator. He doesn't seem to be breathing.
Okay. So he's not breathing. Okay, we should probably call Code Blue, and while we wait, let's go down this algorithm.
Code Blue's been called.
All right. Is he patent? Let's go remove the speaking valve HME. Okay, enter cannula. Let's see.
Code Blue, ICU, bed 13. Code Blue, ICU, bed 13.
I can't hear anything.
Okay, let's try to pass the suction catheter down.
Martha, I can't get this to go.
Let's deflate his cuff. Cuff is deflated.
Should I try and pass again?
Yeah, see if you can pass one more time.
It still won't go.
Straight, because if it's occluded, then I don't think it's working. So let's see if we can take it out. Okay, let's go see if we can ventilate him from the mouth. You're gonna have to hold his stoma while I bag him, okay?
Okay.
All right, here we go. Do you see any chest rise?
There's no chest rise.
Okay, let me see. I might have to go through his stoma, okay? Hold on one second. Gotta switch my mask here. All right, I'm gonna have you hold it through his stoma here. Molly, 2 hands. See if we can get a good feel. All right, I see a little bit of chest rise.
Mr. Jones,
Blinking.
there you go.
All right.
You doing okay?